Hello, my name is Kaleigh Hall. I am an Aspen University nursing student, and this is my Module 6 SBAR report project. For this project, I chose Scenario 3, Obstetrics. Marjorie Colby is a 25-year-old primipara and is in recovery after a low forceps delivery of a 9-pound, 2-ounce male. Although this was an unplanned pregnancy, Marjorie and her husband adjusted to the idea and are now very excited to be parents. Marjorie plans to breastfeed the baby. 45 minutes after delivery, Marjorie's vital signs are her blood pressure is 100/60, her pulse rate is 88 beats per minute, and her respiration is at 16. Her fundus is firm and is at the level of umbilicus. No clots have been observed. She has a continuous trickle of bright red lochia and no change in perineal edema. Ice packs have been applied and peripads have been changed. The peripads and Chuck's weight indicate that 300 cc's of blood have been lost. 15 minutes later, the fundus is massaged and remains firm at the umbilicus level and midline. A constant trickle of bright red lochia persists and no blood clots have been expressed. Peripads and Chuck's weight are showing an additional 200 cc's of blood loss. Her vital signs are now 110 beats per minute for her pulse rate, 20 respirations per minute, and her blood pressure is 90/52. Hello, Dr. Fiorucci. I am here to discuss your patient, Marjorie Colby. She is in obstetrics recovery in room 200. Miss Colby is an hour postpartum and she has just had her first baby. She's experiencing an abnormal amount of postpartum hemorrhage. She has lost 300 cc's of blood in the first 45 minutes after delivery, and 200 cc's of blood was observed 15 minutes after this. The total loss of blood has been 500 cc's in an hour after her delivery. Her blood pressure has been continuously decreasing, and her heart rate and pulse rate are increasing. The fundus has been massaged and remains firm at the umbilical level and midline. Bright red lochia is persistent and no clots have been expressed. There is no change in perineal edema and an ice pack has been applied. Miss Colby is an hour out of delivery and she has no known allergies and is currently on a saline drip and was given an epidural 4 hours ago. Forceps were used during her labor to assist the delivery of the baby. After the fundus massage, it remains firm at the umbilical level and midline. Her most recent vital signs are her blood pressure is 90/52, her pulse rate is 110 beats per minute, and her respiration rate is at 20. No additional tests have been done. I am concerned because the postpartum hemorrhage is not decreasing despite the fundus massages, and her vital signs are telling me her body is in distress. Her blood pressure is decreasing from initially 100/60 to 90/52. Her heart rate is increasing. It was initially at 88 beats per minute and is now at 110 beats per minute. Her respiration rate is also increasing from 16 to 20. My recommendations would be immediately to administer 0.25 milligrams intramuscular of carboprost to stimulate further uterine contractions. I also will continue massaging the fundus every 15 minutes and check peripads and Chucks to see if there's any decrease in blood loss or clot formation. I believe that Miss Colby should be given an oxygen mask to aid in her breathing. I also recommend that we run a hematocrit to see what her red blood cell count is at. If a decrease in bleeding or clotting does not happen within an hour, I believe Miss Colby should be put on clot-promoting medication and that you should be further examining her uterus and other pelvic tissue to ensure there's no remaining parts of the placenta remaining. As her nurse, I want to make sure that we work fast and monitor this bleeding to ensure that no extreme measures need to be taken if this hemorrhaging continues. Now I'm going to discuss the debrief for the class. Thoughts on this clinical scenario. This scenario was very interesting to me, especially since I would potentially like to go into obstetrics or OB nursing. It was very informative and forced me to do research and look up terms and conditions that I was not familiar with. Postpartum hemorrhaging occurs in 18% of births and is one of the most common maternal morbidities in developed countries. Therefore, it is important to take this seriously and act quickly when hemorrhaging is more than 500 cc's after birth. When we notice an increase in bleeding, it is important to start taking precautions, and when it reaches this benchmark, serious medical interventions need to be taken to keep the patient safe. Additional information that could be added to the SBAR. It would have been helpful to know if this patient had a history of excessive bleeding or low blood pressure. These issues might have been a little less concerning if we knew that this was normal for her and we could have taken extra precautions before her delivery. It also would have been nice to have a hematocrit test on file, so when we run the next one, as a part of her assessment, we have a basis of what her normal levels are. There are many different recommendations for postpartum hemorrhage that could have also been added to the recommendations when treating this patient. Based on what is causing the hemorrhage, different treatments are recommended, and this could have been helpful to know. Information that was not needed in the SBAR. Overall, most of the information included in the SBAR was helpful and beneficial in seeing the overall issues in this scenario. The information that could have been taken out are things that nurses will just do and don't need approval from the physician, like massaging the fundus and giving patients oxygen masks. These are things that we will just do and the physicians don't need to give approval on. The name of the medication to aid in uterine contractions could have also been left out. It could have just been recommended that the patient needs to be on a medication that stimulates uterine contractions, and the prescribing physician can give the name and the dose of the medication that they would recommend. What could have been done differently? The information could have been laid out in a more organized manner, and repeated information could have been taken out. It would be useful to identify what is causing the patient's postpartum hemorrhage so the treatment plan can be more tailored to her personal situation. There was information that was mostly unknown in this scenario, like what medications the patient was on during labor. Common ones were made up in this scenario to add information to the case, like a saline drip and epidural. It would have also been helpful to know if the patient's placenta was delivered and if it was fully intact. This way, as nurses, we can know what to expect and look for when further treating the patient. This information could have been discussed in the SBAR and would have been important, and the physician should have been informed about it. The significance of the situation clearly presented to the physician? The significance and the urgency of the scenario was clearly stated in the SBAR, with postpartum hemorrhage being the top cause of maternal morbidity. It is important to act fast and serious when these symptoms are presenting themselves. It is important that short-term and long-term plans are made, and if hemorrhaging continues, we must make treatment plans for immediately, short-term, and long-term. Physicians should be consulted and updated on patient conditions to ensure that no further and more drastic measures are needed to be taken in order to stop the patient's hemorrhaging. In conclusion, SBAR reports are very informative and give nurses a way to organize important information about a case and a patient. It is important that we are contacting the physician with enough information so they can fully understand the case and what is happening. It is also important that unnecessary information is left out because it can add to confusion and take away the severity of the problem at hand. SBAR reports are vital when communicating with physicians, and they often have many patients and cannot keep track of minor details like allergies. This can be very important when treating a patient. Therefore, SBAR reports and describing the situations and giving important information should be considered when treating patients.